Okay, at this time, we'll have our call to order and flag salute. Mr. Surface, would you do us the honor?
Gotcha.
Thank you.
Salute. Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. Mr. Ferris, will you please do roll call?
Thank you, Mr. Chairman. I'm going to turn that over to my EMS coordinator, Danielle.
Okay, thank you.
John Surface.
Here.
Leslie Wilmer. Here. Dr. Lyon. Mr. Flores.
Here.
Chief Linville.
Here.
Maribel Reyna. Kathy Prout.
Here.
And Tyler Wetzel.
Here.
We have a quorum.
Okay, thank you. Okay, so welcome everybody to the Emergency Medical Care Advisory Board meeting Thursday, February 8th. At this time, what brings us to item 4, our consent agenda. All items listed with CA are considered by division staff to be routine and non-controversial. Consent items may be considered first and approved in one motion if no member of the board of the audience wishes to comment or discuss an item. If comment or discussion is desired, the item will be removed from consent and heard in its listed sequence, with an opportunity for any member of the public to address the board concerning the item before action is taken. Okay, at this time, I'll open it for discussion. Is there any member of the public that is wishing to comment on any of these consent agenda items? Now is the time to do so. Okay, seeing none, I'll bring it back to the board for a motion.
Motion to approve. Second.
Okay, I have a motion and a second. Okay, call for vote.
John Surface.
Aye.
Leslie Wilmer.
Yes.
Dr. Lyon.
Yes.
Chairman Flores.
Yes.
Chief Linville.
Yes.
Kathy Prout.
Yes.
Tyler Wetzel.
Yes.
Motion passes.
Okay, thank you. Now, that now brings us to item number 6, subcommittee reports. We'll hear from our APOT task force. Mr. Ferris, would you please like to do the presentation?
Thank you, Mr. Chairman. The quarterly APOT task force meeting was held on January 25th with representation as follows: 4 from Public Health EMS, 1 Kern County Fire representative, 1 ambulance representative, and 5 hospital representatives. EMS gave our report, which included the total number of APOT hours for the fourth quarter of 2023. That is the same report you all have in the packet for the APOT task force for the fourth quarter. In the fourth quarter of 2023, the number of APOT hours totaled 10,174.61 hours. Jenny Wilson, the new emergency department director from Kern Medical, reported that she has been assessing her emergency department and believes that she sees areas that could be altered to decrease the offload times there. It appears that staffing, transport volumes, the misuse of 911, and internal hospital systems are continuing to play a role in the continued delays. In an effort to collect the most accurate ambulance APOT data, EMS has coordinated with ReadyNet and First Watch to create a bidirectional link between the hospital emergency rooms and EMS. This link provides the information on all ambulance transports and gives the hospitals the ability to timestamp the exact moment the patient is transferred from the ambulance crew to the hospital gurney or chair. In addition, this link also provides for an automatic redirect for hospitals that are struggling to offload patients. Redirect will last 1 hour, giving the hospital time to decompress. This new system was discussed during the meeting, and it was impressed upon the attendees the importance of training the ER staff to submit the offload times appropriately. That concludes my report, and I'm available to answer any questions.
Thank you, Mr. Ferris. Are there any questions or comments for staff? Okay, seeing none, we'll move to item number 7, public comments. This portion of the meeting is reserved for persons desiring to address the board on any matter not on this agenda and over which the board has jurisdiction. Members of the public will also have the opportunity to comment as agenda items are discussed. Any? Okay. Now's the time. Seeing none. Okay. That brings us to, there is no public request, no unfinished business. That brings us to item 11. Mr. Ferris, you're on deck again for manager's report.
Thank you, Mr. Chairman. EMS continues to remain busy with improvements to the system, conducting quality improvement reviews, providing training to the public, continually reviewing policies, procedures, and protocols, and many other projects. Our training team has conducted 1 Narcan training and 4 Stop the Bleed trainings and 4 hands-only CPR in the last quarter, for a total of 270 people attending these trainings. EMS has begun providing ride-alongs for CSUB nursing students. Our certification team has completed 224 certifications and accreditations in the 4th quarter of 2023. This includes EMTs, paramedics, emergency medical dispatchers, and mobile intensive care nurses. We have several upcoming mass gatherings this spring and summer. Yes, it's event season. Boots in the Park is a 1-day county concert held at the Kaiser Permanente Sports Complex in Bakersfield on March 15th with 8,000 to 10,000 people expected. Neotropolis in North Edwards is a sci-fi cyberpunk event held April 24th through the 28th with 2,000 people attending. Lightning in a Bottle returns this year to Buena Vista Aquatic Recreational Area for 5 days in May. We're expecting between 20 and 30,000 attendees. Bequinox returns to California City in June for 5 days. This is a regional Burning Man event with between 1,500 and 1,800 attendees. EMS staff review and approve the medical plans for these events, conduct background checks of the event medical staff, and provide oversight at the event locations themselves. Our emergency preparedness team has completed the restructure of the Healthcare Coalition, or the HCC. In addition to the numerous training opportunities already provided, we are adding ICS 300 and 400 to the list. In addition, we have scheduled 6 hospital incident command classes coming up in the next 4 months. Our team is currently looking into other training opportunities to bring to the members. Over the last quarter, EP has been busy working with our HCC stakeholders to release grant funds. These grant funds are all provided to help build the emergency preparedness of these facilities. This year, EMS EP released $115,000 to the HCC partners. The bid process has been completed for our mobile command unit, and it is currently being built. We expect to take delivery in April. This mobile command unit will be used to bring the EMS agency on site to help manage large events in the county, including MCIs and large special events like Lightning in a Bottle. In addition to the mobile command unit, we have completed the bid process for 2 large trailer-mounted generators, large enough to power portions of a large facility or an entire small facility. These generators will be used to assist our medical health partners in the event of a long-term power outage. Our RDMHS team has been very busy over the year, these last few months, coordinating with all 7 counties in the region. Most of this help has been spent assisting counties from past and current winter storms and atmospheric weather events. EMS and EP will be hosting several exercises during the last part of this year. Planning has begun and more details will be released soon. Kern County EMS, Tulare County EMS, the Emergency Medical Services Authority, and the California Department of Public Health are currently in the planning process for a region-wide multi-jurisdictional earthquake exercise. This exercise will include all of our surrounding counties, state agencies, and local medical health providers. As you may recall, in 2019, Public Health EMS hosted an EMS Mental Health Symposium at Bakersfield College. This symposium was very successful in reaching EMS professionals and assisting them in getting professional assistance if they felt they needed it. It was our plan to host a second event in 2020. However, COVID-19 reared its ugly head and took care of that. We are in the very beginning stages of planning a second EMS Mental Health Symposium for later this year. Any agency that is interested in participating with EMS in this important event should contact Alec LaRoque or Robert Lopez at EMS. Robert is in the audience today, so if you would like to speak to him before you leave, you can find their contact information on the EMS website. EMS was notified this morning by Kern Behavioral Health and Recovery Services that they are seeing a significant increase in patients that are presenting under the influence of PCP at the Psychiatric Emergency Center, or PEC. In quarter 3 of 2023, BHRS reported 8 total cases, with 22 cases reported in quarter 4. This represents a 175% increase. So far in 2024, BHRS reported 8 cases. All field staff need to be made aware of this unfortunate increase in PCP use in our system, as these patients can present with very aggressive behaviors. And finally, I wanted to give you all a brief update on the MCAB membership. It's been in flux for a couple of months now. Chris Miller has resigned from the Urban Consumer Group. We are actively looking to replace him. The Kern County Medical Society has submitted nominations for William Franklin, DO, for the member position, and Soham Shah, MD, for the alternate position in that county, the Kern County Medical Society. The Kern County Ambulance Association has submitted a nomination for Aaron Coach Leone from Liberty Ambulance Service to fill that alternate position. Barring any obstacles, these nominees should be available for the next meeting. Our current vacancies include the Police Chiefs Association alternate, the Urban Consumer member position, the Rural Consumer alternate position, and the Kern County Hospital Administrator's alternate position. That concludes my report, and I'm available to answer any questions.
Thank you, Mr. Ferris. A very comprehensive report, a lot of work on a number of fronts. Any comments or questions from our board?
Question.
Yeah, Mr. Surface.
Jeff, does the department plan to put out something on the PCP issue?
We sent something out. You should have received it today. If you didn't, I will make sure you get it.
Okay.
We sent it out to all providers earlier today.
So I'm not in that network, you know.
Oh, okay.
But we've talked about that.
I'll make sure you get it.
Okay,
But yes,
thanks.
you do.
Okay, thank you. And this is an action item. I'll need a motion to receive and file.
Motion to receive and file.
Okay, motion? Second. Okay, please call the vote.
John Surface?
Yes.
Leslie Wilmer?
Yes.
Dr. Lyon?
Yes.
Chairman Flores?
Yes.
Chief Linville?
Yes.
Kathy Prout?
Yes.
Tyler Wetzel?
Yes.
Motion passes.
Thank you. Okay, no.
Mr. Chairman, I'm sorry, I have a point of order.
Oh, sure.
I believe that we need to do the same thing for the APOT task force report
Okay.
to receive and file. That did not occur.
Okay, let's do that. So I'll entertain a motion to receive and file the APOT task force report. Okay, motion? Okay, motion and second. Please call the vote.
John Surface?
Yes.
Leslie Wilmer? Dr. Lyon? Chairman Flores?
Yes.
Chief Linville? Kathy Prout? Tyler Wetzel? Motion passes.
Okay, thank you. There's no business under item 12, so we'll move forward to item 13, board member announcements or reports. If any member has an announcement, seeing none, okay. That brings us to item 14, announcements. Our next regularly scheduled meeting will be Thursday, May 9th, 2024 at 4 p.m. here in the board chambers. And also, item B, the deadline for submitting public requests for the next MCAB meeting agenda is Thursday, April 25th, 2024 at 5 p.m., and that's to be sent to the Kern County EMS Program Manager. That brings us now to item 15, adjournment, and I'll entertain a motion.
Motion adjourned.
Okay. Motion and second. And this is asking for a vote as well? We vote on this?
I think we can.
We can pass. Okay, so we stand adjourned. See you to the next meeting.